Hi, my name is Patricia Luz and I am going to talk about a randomized trial of erythropoietin for neuroprotection in preterm infants. Definition: high-dose erythropoietin has been shown to have a neuroprotective effect in preclinical models of neonatal brain injury, and phase 2 trials have suggested possible efficacy. However, the benefits and safety of the therapy in extremely preterm infants have not been established.
The endocrine system regulates many body conditions with feedback loops. Each feedback loop has the following components: stimulus, a change in a body condition; production cell, an endocrine cell that produces a hormone after being affected by stimulus; hormone, the signaling chemical; target cell.
Application in medicine. In the multi-center randomized double-blind trial of high-dose erythropoietin, we examined 945 infants who were born at 24 weeks 0 days to 27 weeks 6 days of gestation to receive erythropoietin of placebo within 24 hours after birth. Erythropoietin was administered in intravenous a dose of 1,000 U per kilogram of body weight every day in 48 hours for a total of 6 doses.
And went on to win the award for the press for the resident category that year, and recently published his paper. And now we are colleagues and research collaborators. So I have nothing to disclose. And the objectives of my talk today are to recognize neonatal populations that are at risk for neurodevelopmental impairments.
Pros and cons. The control group consists of 365 babies received placebo in the form of a sham injection. The treatment period lasted through 32 weeks of postmenstrual age. The primary endpoint was that of observing neurodevelopmental impairment in 22 and 26 months of postmenstrual age. The share of premiums meeting the main outcome was the same between groups at 26%.
I was talking about EPO neuroprotection as a therapy for newborn infants that are either term with hypoxia-ischemia or preterm infants who are at risk for long-term neurodevelopmental problems. In the talk I gave today, I gave the background data for why it might be therapeutic, and
Injury applique in Ecuador. It is an important factor in fetal brain development, in addition to its hematologic effects, and has been shown to have a neuroprotective effect in neonatal brain injury in preclinical trials and meta-analysis of small control trials.
So Dr. List, could you tell me more, what are erythropoietin stimulating agents, or ESAs?
The ESAs are really synthetic forms of the red blood cell hormone erythropoietin. They're given as an injection under the skin, anywhere from a weekly interval to every 3 to 4 weeks. And they're most effective in people that have low production.
Conclusion: high-dose erythropoietin treatment administered to extremely preterm infant from 24 hours after birth through 32 weeks of post-menstrual age did not result in a lower risk of severely neurodevelopmental impairment of death at 2 years of age.
Well, I think this is now, there's a whole new era beginning, and that is brain care. It's going to be very complex, but we've broken barriers. Cooling definitely works, and now there are a number of really great things that can be tested. The leading thing is this new xenon gas. It's very complicated to use, but it's very promising. And the other thing is erythropoietin. And I think large trials will be needed. We're probably going to end up with about 50 brain centers, and